So I have full rotation in the wrist, so the therapy was focused exclusively on flexion and extension of the elbow.
Age is always a factor. Generally, the younger you are, the better off you are in terms of your recovery. And then just the nature of the injury. You know, in this case, an elbow injury, there's a million different ways you can injure your elbow. Did it require surgery? Did it not require surgery? Is there a fracture involved, a dislocation, a fracture and a dislocation? Is there hardware involved with the surgery? So it's really hard to say. Those are the kinds of variables that can affect the outcome. But the outcomes can and do vary, and the expectations can and do vary, dependent on all those things, like I say, age and the complexity of the injury.
So he'd have me put the arm on the table, and the point is just to re-engage the muscle. After the surgery, you lose muscle memory. So everything from him pulling on the towel and forcing me to work, pushing against him or pulling against him.
Well, and the treatment is a progression. You know, right now, the primary goals are movement. We're trying to increase the range of motion at the elbow. As time goes by, as that motion gets better, as the healing progresses, then strength is going to become more of an issue in the treatment as well. And we'll have to work on, you know, restoring strength to the muscles that power that joint.
Part of the regimen initially was using a CPM machine, continuous passive motion. As you could guess, there's passive motion and active motion.
This is good up to a certain
The
point.
passive motion
And most
is
of the time
you would just sit there and it would passively move it. That's just to keep the soft tissue loose.
Now I do active exercises.
As you
where,
do
like,
it, as
I
you're
am
not engaging the
physically
muscles itself.
pushing on it.
I would typically do 4 sessions for an hour each. I did that for, I believe, the first 2 months. And after that, I moved to strictly active motion. The active motion is where I am engaging the muscles to try to improve the extension and flexion. At any age, you don't want to lose range of motion, but particularly at the age of 25, I would prefer not to lose an extensive amount of range of motion. I look at, even though the last 4 months and probably an additional 6 months to a year of therapy and working on it my own is going to be rather difficult. I would prefer to put in the time now and have as close to full range of motion back as possible for the rest of my life.